We have some breaking news from CVS. The company seems to be pushing back a little bit on the narrative that governors from many states have been kind of laying out there, that the reason they're not getting vaccines out more quickly to more of the population is because companies like CVS and Walgreens have fallen behind. That's been the narrative we've heard even from Governor Phil Murphy of New Jersey here on our very own air on CNBC over the last week or so. Well, listen to this. CVS says that it has actually completed and is on track with the vaccine doses that it was contracted to give at skilled nursing facilities. They say they've delivered the first round of doses to 8,000 skilled nursing facilities, and the second dose is underway there, too. They expect that to be complete in 4 weeks. There's a comment from the incoming CEO, Karen Lynch, who says, "We've administered nearly 2 million shots to one of our most vulnerable populations through on-site and, in many cases, room-to-room visits." It hasn't been easy, I know. A lot of this is happening when you're dealing with these vulnerable populations and you actually have to go in to these care facilities and go room by room. The Federal Pharmacy Partnership Program divided long-term care facilities into 2 categories, CVS points out. The first was skilled nursing. The second is assisted living in other facilities. And they say that most states actually chose activation dates for when CVS could visit that second category, meaning when CVS could go ahead and go to some of those assisted living facilities that were well into January. They give a timeline for when this all happened. And in some cases, in fact, for Illinois, excluding Chicago and Wisconsin, that date is just today. So when you hear pushback, Maryland just happened on the 23rd of January. That's the first time they could get into some of those. I think what's happened is it's a pretty confusing set of federal guidelines and a lot of different things that have to be put into place. But again, this is CVS kind of telling their side of the story, pushing back a little bit on the narrative that it's the fault of these big boxes with CVS and Walgreens for why you're not seeing a faster rollout of these vaccines in some states. Joining us right now to talk about this and much more is former FDA Commissioner Dr. Scott Gottlieb. He currently serves on the boards of both Illumina and Pfizer, and he's also a CNBC contributor. By the way, he has a new op-ed in the Wall Street Journal that says, "Send out the search party for new COVID strains." And we're going to talk about that, too. Scott, why don't we start with what we're hearing from CVS? Because there has been this narrative that's been pushed by a lot of governors that it's not their fault for these vaccines not getting rolled out more quickly. It's pretty confusing stuff.
Yeah, and I've given advice to CVS. I know the management team well. I think one of the challenges for both CVS and Walgreens here was that when the vaccines were initially authorized, the consents weren't in place in these nursing homes. So you have to consent the patients in the nursing homes. And many of the patients in the nursing homes, at least some of them, don't have capacity to give consent. So you have to go to the family members and get consent from family members. And that takes a very long time. It could take a matter of weeks to get all those consents in place. And you want to make sure they're all in place before you visit the nursing home, because the pharmacies know they can't keep going back to these nursing homes. They can come back for 2 different visits, but they can't come back for individual patients just given the very difficult logistics. So they took literally weeks to get these consents in place in these nursing homes. Now, quite frankly, this is something the government could have worked on in advance. Now, what the government will say is that, well, we didn't have an approved fact sheet from FDA, so how can we consent patients until these vaccines were approved? But there were ways to get an approved fact sheet, an authorized fact sheet in place prior to the approval of the vaccines that you could have been using to consent those patients. So by the time these vaccines were authorized, you had all of those consents in place, which took literally 3-4 weeks to get in place in most of these institutions. So they couldn't go in day one. And that was a real challenge. I think that could have been solved for. It wasn't. But that's part of the delay here.
Shepard Smith here. Thanks for watching CNBC on YouTube.